Welcome back to Fox 10 News at 4. You know, September is Polycystic Ovary Syndrome Awareness Month, and you may not have heard of that before. Don't worry. If you're not familiar with it, we have the experts in right now to talk more about this disorder that is found in women of reproductive age. I've got Dr. Tracy Roth from USA Health joining me. Gotta let that pass. Okay, because I want this information to get out. It is very important. How common is this?
It's actually quite common. Between 5 and 10% of women of reproductive age, so between like 18 and 44, have PCOS.
And tell us what it is for those who are thinking, do I have that?
So basically it's a hormonal imbalance. It's primarily having too much of the male type hormone in your system, and it disrupts the way the ovary functions. So it leads to things like menstrual irregularity, facial hair growth where you don't want it, sometimes obesity or just being a little bit overweight, having difficulty losing weight. Those are some of the main symptoms. And then a lot of women present between their 20s and 30s because they're having some infertility issues.
Oh, wow. Okay, so if you are experiencing this, you would know.
Probably so. I mean, most women are going to come in complaining that maybe they have a period every 30, 60, 90 days, and it's just irregular. So that's not normal unless you're having that problem because you're on some sort of medication to cause that. So you need to come in and be evaluated for that. Women who feel like they have excess hair growth or they're having weight issues along with those problems, should come in and be evaluated. It's important too because it leads to some what we call insulin resistance, which can increase your risk of developing diabetes in your lifetime. So that is an important thing to be followed and treated as needed as well.
I was going to ask you, if left untreated, what can this cause? I mean, does it adversely affect the ovaries? Would that keep you from...
It doesn't, well, it does disrupt the normal hormonal balance in the ovaries, which then can make you not ovulate regularly. So if you're trying to get pregnant, you can't get pregnant if you don't ovulate. However, the good news is there are medications and things that we can use to try to help that process. The other issue is if you don't have a menstrual cycle every month, the lining in the uterus can build up and get thicker. And over time in your lifetime, that increases your risk of developing cancer in the uterus.
That's right.
So that's another reason that this needs to be treated.
All right. And a lot of information about this. We've got some of these symptoms for you on our screen, but you guys are covering this with the Awareness Month being September. What are some campaigns people can get involved in, or what do you want them to do?
As far as, I mean, the main thing I think is for people to take charge of their health and recognize if you're having these symptoms, realize, if you're not in a situation where you're wanting to become pregnant, sometimes using birth control pills, and there are other medicines that we can use to control these things, having regular checkups, finding out what your blood sugar is, making sure you're not pre-diabetic, getting on a good nutrition plan and exercise. Those are all things that people can do to help themselves.
There you go. Well, I appreciate you for stopping by.
All right. Thanks for having me.
And in this heat as well, we're going to have this interview for you along with other segments on our YouTube page. Subscribe, and then that way you'll be notified and you'll never miss an alert when we upload a new video there, and especially